Welcome to Connected by Health. I'm Dr. Krishna Vedala. This is where medicine meets leadership, innovation, and humanity with one goal: to add value and help change healthcare for the better. If you believe health is about more than a diagnosis, you're in the right place. Today, we'll be talking about vaccinations. Vaccines are one of the most effective tools in modern medicine, preventing millions of deaths each year by protecting individuals from dangerous infectious diseases. By building immunity before exposures, vaccines not only protect the person receiving them, but also help create community immunity, reducing the spread of disease within the population. Widespread vaccination over the past 150 years has led to the control or near elimination of diseases such as polio, measles, and smallpox, saving countless lives and strengthening public health worldwide. And to discuss vaccination, today we're joined by Dr. Alexander Mock, a board-certified pediatrician. So today we'll be discussing and addressing vaccinations, some common myths and side effect concerns, and a whole lot more. Whether you're a new patient, a caregiver, or a health professional, this episode will offer clear, evidence-based guidance to help you make informed vaccination decisions. Dr. Mock, welcome aboard.
Hey, thanks for having me. I'm excited to be here.
Thank you so much. So tell us a little bit about yourself and what made you want to go into medicine and specifically pediatrics?
So my name is Alex Mock. I'm a board-certified pediatrician practicing outpatient primary care in Oklahoma City. Like a lot of people in medicine, I was really drawn to the science of how the human body works, and really wanted the opportunity to help people in a very tangible way. Throughout medical school and through my rotations, I realized or affirmed that pediatrics was where I felt most fulfilled. Kids are extremely resilient, and so much of pediatric care focuses on prevention, like helping kids stay healthy rather than just treating illnesses. I really enjoy working with families and getting to know their stories. Us pediatricians don't just care for the kids. We partner with parents and other caregivers to really guide development, nutrition, safety, and offer all sorts of preventive care over the course of many years.
Well, one of the reasons why I have to confess I was hesitant to go into pediatrics myself was because I was worried about how to interact and to sometimes keep the parents calm. But that's why I have a tremendous amount of respect for pediatricians, because it's not just a matter of, like you said, just taking care of the children, but also it's encouraging and then strengthening the parents. And that's why I've always felt that pediatrics is a much more difficult field than what it's made out to be. But thank you so much once again for being here and for everything that you do. Let's get started with some of our questions today. How do routine childhood vaccination schedule protects individual children and the wider community? And why are on-time vaccinations important?
So childhood vaccine schedules are very carefully designed based on two very big things. So when the child is most vulnerable to certain infections, and also when their immune systems respond best to vaccines. By vaccinating on schedule, we give kids protection before they're likely to encounter these diseases. So, these vaccines don't just protect the children that receive them, but, they also protect the community. So when a high percentage of people are immunized, it can reduce the spread of disease and protect individuals who can't be vaccinated, like either newborns who aren't old enough or other kids with certain medical conditions that exclude them from receiving certain vaccines. And so the schedule isn't arbitrary. It's very carefully thought out, and it's really about protecting kids at the time they need it most.
So this is a question that I get from a lot of my patients, because although I'm not a pediatrician, I tend to see a lot of the children's parents as my patients. And so one of the questions they always ask me is, can vaccinations be given at different intervals other than the recommended schedule?
So, the recommended vaccine schedule is based on decades of research that looks at safety, effectiveness, and the timing of disease risk. And, in general, we encourage families to follow that schedule because it provides protection as early and as safely as possible.
Mhm.
There are situations where vaccines may be spaced differently. For example, if a child maybe started receiving their vaccines late or maybe missed some doses, but intentionally delaying the vaccines can leave children unprotected for longer periods of time. And so my approach is always to work with families, address their concerns, answer questions, and help them feel comfortable staying as close as possible to the evidence-based schedule.
Got it. What are the most concerning risks associated with doing these vaccinations at different intervals? I know infection is obviously the most concerning one, but are there other concerns that we would have if vaccinations were given at different intervals?
Um, I think one of the bigger concerns that I get with parents is, they don't want to overload the kid's immune system. They
Mhm.
feel that oftentimes receiving 4 shots at once or 3 shots at once can cause their immune system to be overloaded and maybe not produce an immune response. But what a lot of parents don't realize is, their kids are exposed to thousands of different microbes and pathogens every day. And so their immune systems are more than capable of handling multiple vaccines given at once.
Well, yeah, definitely. That is also something that people keep bringing up, and even my wife. I'm going to confess, even my wife had the same concern with our son, and that was always something that I had to help her kind of show the data and also help her understand, and also do a little bit of teaching on the side, which was it's a little bit hard when you're trying to teach your wife because you can have all the degrees in the world, but you're not really a doctor to your wife. You're always considered the husband. Speaking of
Absolutely.
which, what are some common vaccine side effects that you tend to see in children, and how should parents manage them at home?
Most vaccine side effects in kids are very mild and temporary. And so the most common things we see are soreness at the injection site, mild fever, fussiness, or fatigue that lasts maybe a day or two. These reactions are actually signs that the immune system is responding to the vaccine. At home, parents can usually manage those symptoms with rest, fluids, and weight-based doses of Tylenol or ibuprofen being appropriate as long as the child is 6 months or older. Serious reactions are very rare, but they can happen. But pediatricians always encourage families to reach out if they have concerns after a vaccination. A lot of parents will talk to me about the risk of severe vaccinations and how they feel like it's just not worth that risk to receive a vaccine for something that's eradicated. What I often discuss with parents to look at vaccines as needing to be 100% safe is just it's just not realistic or reasonable. There's nothing in this world that is 100% safe.
Yeah.
Like you and I speaking here today, you know, it is not safe. Like something could come flying through the window and cause us harm or even death. There's so many factors. And so having a rate of serious reactions less than 1%, I would consider vaccines to be among one of the safest things that we do in
Mhm.
medicine.
No, I agree. And you touched on a very important concept, which is nothing can really give you or guarantee you 100%. That's never really going to be the case in life. And that's just something I wish that we could emphasize more, which is vaccinations are there to prevent, but they're not necessarily a cure, right? And they can never really 100% prevent anything, but the benefit that they give tremendously outweighs any of the risks, which are really, if you think about it, I mean, less than 1%, very, very minimal. You already kind of touched base on. Good.
Yeah, I mean, I think that's one of the reasons why vaccines receive such scrutiny is because their effects are essentially invisible for the majority of people.
Yeah.
Those of us in healthcare who have actually seen a lot of these vaccine preventable illnesses, like we can see how well these work and how effective they are. For example, if you're walking across a bridge and you get to the other side safely, you're not going to think about how safe the bridge was because it's just an expectation that the bridge doesn't collapse. And vaccines work the same way. The benefits you receive are invisible for the most
Yeah.
part for the vast majority of people.
And that's kind of there's a thinking which is that vaccines, unfortunately, are a victim of their own success because people, especially in our generation, may not really know how polio looks like, right? Because we don't see polio anymore because of vaccinations. And so there's less of an incentive when you don't really know how serious the consequences are. There's less of an incentive to really take the vaccination now, which is ironic because the whole reason why there's less of an incentive is because there's less disease because of less vaccination. So really, vaccines really are in many ways just victims of their own success. And I think that's very ironic and tragic at the same time. You know, we talked about the benefits of vaccination, and you already kind of touched base on this earlier in our conversation today. But what specific communication techniques or resources do you use in order to discuss vaccine hesitancy with concerned parents?
Most parents asking questions about vaccines aren't necessarily opposed to them. They're simply trying to make the best decisions for their child. I try to understand their concerns first and then provide clear information in a non-judgmental way. Really, the key is building trust over time. Sometimes that means discussing how vaccines are studied, how safety monitoring works, and also what we see in clinical practice. Sharing experiences, like some of my personal experiences from during my residency training and my months in the PICU and seeing very poor outcomes have been very effective. But ultimately, it's important to know that our goal is shared. We all want children to be safe and healthy.
Yeah, definitely. Since we've discussed now how you address vaccine hesitancy, and you really hit the nail in the coffin, specifically talking about listening, right? It doesn't really take that much. Just listening and doing so in a non-judgmental way really does help the parents understand that you're putting not just their children's needs, but also you're respecting their time and you're also respecting their input. And that I think does make a significant difference in terms of building, like you said, the trust. Since we've talked about vaccine hesitancy and some of the communication techniques that you use, let's look at some of the vaccines that are really critical for infants and toddlers. Which of the vaccinations do you feel are the most critical for infants and toddlers?
To be honest, all of them
Hmm.
are critical in their own ways. These early childhood vaccines protect against several diseases that historically have caused serious illness in kids. Vaccines such as the DTaP or the tetanus shot or tetanus and whooping cough shot, the MMR vaccine, which prevents measles, mumps, and rubella.
Hmm.
And then also vaccines against pneumococcal and Hib infections have dramatically reduced hospitalizations and deaths in children. The generation of doctors before us, who worked in the emergency room, would get incredibly proficient at doing spinal taps, lumbar punctures in very young infants because infections from Hib, would cause meningitis in kids. And so every shift they would come in and have to do one or multiple spinal taps. And so really one exciting development in recent years is new prevention for RSV, which is a virus that can cause severe respiratory illness in infants, especially, very young infants. During residency, every winter, we would have the entire pediatric floor or the pediatric hospital filled with kids with RSV. It wasn't just our hospitals, hospitals around the country were full and just did not have room for these kids. And since the introduction of this new monoclonal antibody, or nicknamed the RSV vaccine, we've seen a dramatic decrease in that.
Uh-huh.
And even in my own practice, I've seen just last RSV season, had one child who was 3 or 4 years old who was having respiratory issues, and then the next day, I had a 9-day-old with RSV as well that had very minor symptoms. And really, the only difference between the two was that the newborn had received their RSV vaccine. So advances like that really show how pediatric preventative care continues to evolve day after day.
Are there any other emerging vaccinations that you're keeping an eye on?
Not completely new per se. There have been some new combination vaccines. For example, for our teenagers, there are the meningitis vaccines, which historically have been 2 different vaccines. one covering meningitis A, C, W, and Y, and another one covering meningitis B.
Oh,
And, there's been a new combination that covers all 5 strains. And so,
whoa.
yeah, I mean, combination vaccines, I think are, one of the more, I'd say, more common interventions or innovations, because saving children needle pokes can go a long way, especially those very young children who may already be terrified at going to the doctor.
Yeah. No, definitely. That does make a big difference. And I know that from personal experience since I've been a dad the last 16 months of my life. Speaking of which, when you're looking at chronic health conditions or the immunocompromised statuses of various different illnesses, what vaccine recommendations really would differ for children with such chronic health conditions or immunocompromised status?
Kids with chronic medical conditions or weakened immune systems often need individualized vaccine plans. In many cases, vaccines become even more important because those children may be at a higher risk of complications from infections. So we pediatricians often work closely with specialists such as, oncologists or immunologists to determine which vaccines are appropriate and when they should be given based on the child's health issues. So protecting those children is also one reason that community vaccination is so important.
Mm, of course, of course. So now, since you mentioned community vaccinations and specifically the importance of everyone getting them, so therefore you have some degree of, and I'm going to be using this term carefully because I think it's been misused before out in public, herd immunity, right? And I think it's really important that we emphasize that the more people get vaccinated, and you have to hit a certain percentage, the more likelihood of you have less people getting those infectious diseases, especially children that are immunocompromised and have other chronic diseases similar to immunocompromised statuses. So, speaking of community, what role can schools and community programs play in maintaining vaccine coverage? And do you think clinicians can partner with them more effectively?
Absolutely. Schools and community programs play a huge role in public health. The school vaccine requirements have historically been one of the most effective ways to maintain high vaccination rates and
Okay.
prevent outbreaks of diseases like measles. So we clinicians can partner with schools by helping families understand vaccine requirements, participating in community education, and also making vaccines available through clinics and outreach programs. It's really a collaborative effort between healthcare providers, schools, and families.
I really want to thank you so much for taking your time and answering all of our questions. And once again, to all those listening, please vaccinate. It's really important. There's a tremendous amount of research that has been done that shows the safety of vaccination, but also vaccines are perhaps the most single important factor that have led to the improvement, nearly the doubling of human life expectancy in the last 150 years. But Dr. Mott, once again, thank you so much. And before you head out, I was wondering if you had any words of wisdom for any of our audience members that are looking to go into pediatrics or are interested in going into some form of healthcare collaboration with pediatrics.
Absolutely. Yeah. Yeah. And so I think the overall climate of medicine and really politics nowadays is very focused on prevention. We pediatricians and primary care doctors have an extremely important role to educate the public in a society where there's so much information online and parents are just overloaded and often don't know who to trust. And by going into primary care, we can really bridge that gap. Medicine nowadays is it's oftentimes viewed as a business, but it's also an art form. A lot of people will discourage others from going into primary care because you're essentially have to deal with everything. And a lot of times it's it can lead to, feeling overworked, feeling burnt out. But there's so much technology nowadays to um, help you just
Mm.
practice medicine. For example, there are AI scribes or actual scribe that can listen in on your visit and type your note. And then more recently, one thing I've been looking into is additional training with my EMR. Like I think most doctors' complaints, at least in primary care, is just all of the non-clinical work that you have to do, whether it's responding to in-basket documentation, reviewing outside records. But there's so many tools that can really cut down on that and give you more time to face your patient and talk to them, and then also educate them. And so it really takes, a special kind of person to play that role. And, I think right now is as important of a time than ever to look into going into primary care.
No, definitely. And once again, thank you so much for mentioning the need for primary care. It really does make a difference. And we are going to be several thousand primary care doctors short here probably pretty soon. By the end of the decade is the concern, just because of the impending retirement of other physicians here in the next couple of years. But once again, Dr. Mock, thank you so much. We really appreciate you taking the time and answering our questions. And to our listeners, today our intent was to give you an objective podcast about vaccinations, about the benefits of vaccinations, and about the need for vaccinations. And so if you're listening, once again, remember, vaccinate. The research is there, the financial impact is there, and there's so much good that vaccines do. So please don't forget to vaccinate. Once again, Dr. Mock, thank you so much. It was a pleasure having you, and we look forward to having you on the show again here.
Thank you so much for having me. It's been fun.
If you found this conversation valuable, share it with someone who could use it. And if you're on Apple, we'd love to hear your favorite takeaway and a review. See you next week.